All righty. Welcome back, everyone. It is Sunday morning. We are on day 3 of the Natural Pet Care Summit. And other than a little glitch last night, it's all going great. And so our guest from last night who was not able to attend will be on at 7 p.m. tonight. So you're getting an extra session. Yay. So check your email for that link. So for this morning, I'm really excited. I have Dr. Michelle Broadhurst as my guest today, and she's originally from South Africa, I do believe, if I have that correct. Okay, great. And I don't even know how she and I met. I think she emailed me about something, and then we hopped on a Zoom call and immediately clicked and hit it. Every once in a while, you find someone where you immediately say, wow, I really like this person. And she is a doctor of chiropractic and also a certified canine rehabilitation practitioner. So it's a really interesting combination. And there's only a few people who can claim that combination of credentials. She's brilliant and really at this point, I think spends a lot of her time teaching veterinarians and other practitioners how to do what she does so that we don't have to, when you're the only person who does something, it's really hard because you can't be everywhere. So I really appreciate that she is willing to teach us as well as the doctors who are working on your pets. So Michelle, thanks for being here.
Thank you so much for having me. I'm excited to talk to all your listeners.
So, and this will be recorded. So you guys, you don't really have to take a lot of notes or anything. You will get the recordings in your inbox sometime next week. So stormy days make your SM dog suffer more. Yeah, it does. We've got no rain here. It's dry. I would actually like some rain. So Michelle, our title today is myofascial pain in the canine patient. So I have a couple of questions. First of all, can we get myofascial pain in other animals, or is this a dog thing?
Myofascial pain is relevant to any species, pretty much. And the reason for that is that we have this amazing fascial system that up until about 30 years ago, we used to just forget about. I remember being in anatomy dissection and they were like, there's this icky white stuff, you just have to cut it out. We don't know what it does. And in the last 20 or so years, especially in the human world, and now it's coming across into the veterinary world, we've really started looking at the fascial system and the muscular system and how it integrates as a whole in every species on a neurological and a biomechanical level.
So for those who aren't familiar with the term fascia or fascial plane, can you kind of give us a description of what that is, where we find it in the body, and how it actually works?
Sure. So if you look at your skin, that's the first protection that we have. Every animal, every species has that pretty much. Underneath the skin is this connective tissue network, which is almost like a spider's web. So it goes right throughout the entire body. And the beauty about fascia is that it actually diversifies. So that is the thing that goes to form our ligaments, our tendons, our bursas. It has this incredible neurological network. So just like a spider's web, if something is going on the toe, it's going to send a message all the way through that system to the brain, and things are going to accommodate and compensate for something that's going on at another level. So it's very, very important that we treat the fascial system and the muscular system together, because the fascia also helps to allow the body to move correctly. So it actually allows for mobility so that things can move. So there's little fascial sacs around every organ so that they don't stick together. There's fascia around the vascular system so that they can move freely. And of course, there's the whole musculoskeletal system that creates this connectivity network that allows the brain to really know where everything is and what's happening at a certain time.
Very cool. So what would cause the fascia to not function correctly, to transmit and make things move the way they're supposed to?
So tons of things, honestly. Dehydration, interestingly enough, is a big one. So fascia is almost like the sponge that you have that you wash your dishes with. If it doesn't have any water, it becomes really hard and it can't be pliable, and so it doesn't work very well. So if you try to scrub a pan with a dry sponge, nothing's going to happen. But you put some water into that, and all of a sudden it's a very functional thing. Fascia is exactly the same. So if we have dehydrated fascia, and this can come from a multitude of things: one, not enough water, very simple.
Dry
Two,
kibble diet.
absolutely, exactly. Not balancing correctly, not having the correct supplementation. So having an imbalance through your pH also makes a huge difference. Trauma is a huge one, scar tissue. So any kind of issue that has happened at a certain area where the fascia is not able to be pliable and move correctly creates dysfunction and adhesions, which creates little road bumps, basically. So little speed bumps in the fascia. And if we have speed bumps, everything slows down and things don't work as well. So there's a multitude of things. So nutrition's a huge one, acidity, also organic issues that may be going on, endocrine disorders, things like that, kidney disease, and of course then trauma, surgical, post-surgical stuff. So lots of scar tissue, things like that, create all these adhesions that don't allow the body to function correctly.
So how would someone know, one, if their pet were having, well, or themselves, we're going to talk about people too. So how would someone know if they were having an issue at the fascial level, and how would they figure that out on their pet or themselves?
So let's just backtrack one step. So one of the things that I always teach about is nothing ever stands alone. So when we talk about functional stuff, we're looking at the muscular system, the tendinous, ligamentous, the burses, all the soft tissue stuff is functional. Even on a vascular level and a neurological level, a lot of the time it's functional. Then we've got the structural system, which is basically your vertebrae, your spine, your joints, everything that kind of, all the hard bits that make us go. So the two of them work very integratedly together. And at the top of that pyramid is the nervous system. And the nervous system is basically where everything happens, all the communication happens, and then it kind of goes down from there as to how the output should be done. So ideal, and when I teach, I talk a lot about pain and descending pain pathways and how the brain interprets pain and then does what it needs to do to keep going. So that's what, and the reason why I precurse with this is because this is exactly what happens. So very often you're going to see your dog limping a little bit. They might have stepped on a thorn or let's take something simple, a stone, and bruised a foot. Now they're walking differently. So we start having compensations elsewhere. And very often what is going on at the point of issue is actually ends up not being our biggest problem, because that heals up nicely. But now we've got all these other knock-on effects that are going on. So little things that people can look for blatant fascial issues is a little bit of puckering of the skin. And what I mean by that is almost as if you've just like rolled up a piece of material and you can't pull it straight. So these little folds that start to happen, and they look almost like someone's taken a comb and pulled it across the skin, and we see these little dehydrated areas. The other thing that we check for is always with skin rolling, where basically you take the skin and you roll it like you would a little piece of pastry, so that we can see whether the skin is actually moving away from the fascia. When we get dehydrated fascia and issues, it actually sticks together. So you can't pull it apart and manipulate it. So very often what happens is we get these little sticky bits all the way through. So
Interesting.
yeah, so there's the puckering, there's the adhesions, and then very often you'll see points of tightness. So one of the things that we talk about a lot is these compensations that occur. So let's say we've had a sore on our left front. You may find, because of the diagonal and the way that biomechanics work, the right hind is going to start taking the pressure off that left front. So we start looking for changes in symmetry. We look for differences in the muscle development, all of these sorts of things that can give us really good pointers to what might be going on.
So this goes back to what Dr. Tobias was talking about yesterday when he was saying how important having the spine functioning well so that we get good blood flow, we get good nerve flow. And he and I started to have a discussion about horses because we both started out in the horse world, and watching the animal move and looking to see whether we have fluid movement or do we have pistoning action,
Exactly.
pounding of the legs or a limp or a head bob. And really even just standing your dog up and and you can take photos if you want to, or you can feel down the legs, compare one side to the other. Does one have more muscle development than the other? Is the dog not using one leg as much? So maybe the muscles are shrinking away a little bit on that side. So it really is kind of going around trying to get your dog to stand up straight, and then kind of going around and saying, well, is he leaning off one leg? Does he? And they have these really cool force plates and scales now.
Yes.
They make a 4-quadrant scale. So you place the animal with one leg in each quadrant, and it weighs how much that quarter of the animal weighs. And it's really interesting. They're about $10,000, so not many vets have them yet, but it's really interesting because you can compare. You think your dog is standing up square, and then you look at it and you go, oh my gosh, he's got 40 pounds of pressure on that side and 22 on this side. We got a problem that we didn't even know about potentially. So really pretty cool. I have a question. So somebody said, so hydration is important. Yeah, hydration is always important. Most of us are running around dehydrated most of the time. You're supposed to drink your equivalent of your body weight in ounces per day. And really that goes for our animals too. It's 30 mLs, which is an ounce per pound of body weight. That's how much fluid we really need to just take care of general maintenance. And then if we have vomiting or diarrhea or any kind of fluid loss, kidney disease where they're peeing everything out, then we have to even up that amount of fluid that's being taken in. So you were talking about things, like stepping on a thorn or, just something that throws their balance off, and then we can get kind of a lock in some fascia somewhere. Without knowing about fascia, most of us would just say, ooh, he's got a tense muscle or a pinched nerve. But really, a lot of what's happening, as I'm getting from you, is that the fascia is having a problem moving and transmitting. Correct? Okay.
Yeah.
So what kind, do we see this problem? I think I know the answer, but if an animal is given a vaccination or an antibiotic injection or any kind of injection, we're putting that in the muscle or under the skin in that connective tissue layer. Are we doing damage every time we are entering that level with something sharp and injecting a foreign substance into the body, whatever it might be?
I think any time that we pierce the fascia in a non-therapeutic method, I suppose, outside of using acupuncture, needling, things like that, it's a really, hypodermic is a pretty big needle.
Right.
And because we are creating now basically a space occupying lesion, right? Because when we're injecting something into an area, we are creating more space, we're filling that space that shouldn't be filled. So the body on a nociceptive and on a mechanoreceptive level, and what that means, guys, for those of you that are just pet
not
owners,
medical,
not medical. What that basically means is that the brain is going to go, oh, something is going on here that shouldn't be here. So it sends all these different mechanisms to that area to try to protect it. So how fascia is amazing, and so is muscle, is that it's always trying to protect something. So what very often happens is that we get an addition of scar tissue growing around that area. And unfortunately, what often happens is if the injection or something creates a little bit of an abscess, or it doesn't completely go into the body very quickly, it becomes encapsulated, because that's how clever the body is. So it creates the scar tissue mass that accumulates in that area. And that's more than just a speed bump. That's a mountain. And all of a sudden we have lymphatic stasis, we don't have correct blood flow, we get a neural accumulation in that area. So basically the nerve receptors go insane and they're like, oh my goodness, this is so painful, which is why so often at an injection point, they're very, very painful. So we get this accumulation of scar tissue that if we don't break it down, we're going to have big issues later, because now we've got this mountain where we should have a flat road.
Okay, so I'm going to come back to that. I have to write it down because I see squirrels and I'll forget it. Somebody asked, would acupuncture cause this? And I think the answer is that the acupuncture needles are very, very small and they're not hollow. And the purpose of the acupuncture is to actually get the energy flowing. We're making qi flow through the area. So in the case of putting an acupuncture needle piercing the skin, we're actually trying to help the problem rather than causing more trouble. Is that correct?
Correct. And remember, with acupuncture and myofascial work that we do, we're actually going to induce micro trauma in those areas of fascial adhesions so that we can actually break it down. And the way that the body does that is it actually sends all these beautiful things to that area. So, you know, to blood flow and macrophages and stem cells and all these amazing things that go and actually break down that adhesion by a different format, which we can talk about in a little while. But basically, by using acupuncture and therapeutic methods, that actually helps, it doesn't hinder.
Okay. And so somebody said, what about aquapuncture? If you're putting in some B12 or some Traumiel or something, or saline, is that more likely to cause more adhesions and speed bumps? Or is, again, that going to bring more energy flow because we're using, I mean, it's still a small needle, but it's a little different.
And again, remember that we're bringing something to the body to a specific point. So when we're doing B12 and acupuncture and Traumiel, Zeal, whatever it may be, they're going to inject it into the area that it has the adhesion. So it's going to aid with the breakdown of that trigger point or whatever it may be, so that you can actually get that to dissipate and heal. So no, in those sorts of cases, if it's administered correctly, it can be incredibly helpful.
Right. So that's actually a treatment to use in a place where we've already got a fascial problem.
Exactly.
Okay, cool. All right. Somebody says, would SubQ fluids help adding more hydration, help with adhesions, especially with severe adhesions in the shoulders and sides? So when and we have a lot of animals that are on SubQ fluids for kidney disease in particular, that we're taking up a lot of space with the fluids that we're injecting. And I'm going to let you answer that, but I kind of feel like it could go either way.
I agree. And to be honest, I'm always pro drinking.
Sure.
If at all possible. Just because, that's how we were designed, is to really use our fluid correctly, get it through our body, work it through so that it's actually getting rid of toxins and things like that. When we're doing SubQ fluids, it's much more medicinal for those kidney patients and things like that. I would not necessarily advocate for that in most cases, unless we probably had a kidney issue where we weren't able to process those fluids correctly.
Right. Okay. All right. So now we'll go back to what was my squirrel thing, which I think a lot of people are asking as well. Yeah, I've heard that using SubQ ozone and acupuncture in the area will help break down the adhesions. And I've had the ozone injections, and they do. Hurts like heck when you first do it, but they are very helpful. So how do we get rid of the mountain? Is there? How do we get rid of the mountain?
Well, I think there's a number of things. So, of course, having a practitioner who can do something like acupuncture, myofascial acupuncture specifically, is very helpful. There are other tools that one can use, such as lasers, extracorporeal shockwave. Hands are wonderful. We love hands. I love hands. Hands are always my first tool.
Sure, because hands are something that we all own.
Exactly.
And that our veterinarians own. The number of practices that have cold lasers now is definitely increasing, but there's still a lot that don't. And the number of acupuncturists is increasing, but there's still a lot of people who live in areas where they cannot get that done. And there aren't very many people who do what you do. So it's pretty important to, have some tools that maybe people could do at home. When they find that, when they look at the skin and they see that little ripple and dimple where it's like, oh, something. And it's so funny because I never really thought about it that way. And I'm thinking back to some cases that I've seen where I'm like, oh my gosh, those dogs look like they had speed bumps in them. So darn.
Yeah.
Speed bumps. So what are things that people can do? And, part of the problem, and you spoke to this a little bit, is, they're limping because they stepped on a thorn. They've got a hole in their pad. The pad heals and we think everything is fine and dandy. And, then 6 months later, it's like, wow, he's got a little muscle atrophy in that leg. He's just hasn't been the same, or he walks crooked now. So what happens a lot of times, and particularly with traditional doctors, is they hone in on the hole in the pad.
Yeah.
And no one ever looks at the biomechanics that happen to the rest of the animal. Think about if you've ever, I had this friend in the horse show world. She was one of the horse show moms, and watching her walk, her shoulders were like this. And the drop shoulder, she also had a raised hip on that side. So she walked around like this C and kind of hobbled all the time. And I thought, that is so uncomfortable. And she is ruining her joints by having really poor biomechanics. Then I didn't see her for a few years. And when I saw her again, she was completely straight and, 4 inches taller. And I said, wow, what did you do? Thank God you look so much better. So she finally had gone and gotten some chiropractic care and gotten rid of, the C and the crunch.
Yeah.
We walked around like that for a good couple of years. So I was actually pretty amazed that she was able to get it fixed. So what are some things that people could try at home, or, think ways that they can, besides looking at the skin, are there things they can feel on the body, like ways they can scan to try to find areas that are maybe in tension or painful?
Well, here's the thing. You guys know your animals better than anybody does. And, as practitioners, we often forget that. And it's one of the things that I always encourage people to really remember is that you spend every day with these animals. You know what is normal and what's not normal. So coming back to your about the stance analyzer, which I love. I don't have 10 grand to throw at it, but I just love the idea. But before these things came out 20 years ago, what I actually used to take, and I don't know what you call it here. I think you call it Play-Doh.
Oh yeah.
Like sticky putty.
Yeah.
And basically it sounds really bizarre, but if you put it underneath your dog's paws and you make them stand square, and you move them, so you let them stand there for about 30 seconds and you take them away. It is actually quite remarkable. The imprint that they leave can tell you so much about how they are distributing weight.
Holy cow. All right, Play-Doh.
I know.
Everybody go buy your Play-Doh.
So
we're going to stand your dogs on it. This is so cool.
And again, this is very like back in the 1800s, but it gives you a great idea. And only in the last, I would say 10 to 20 years have we seen a million TPLOs and cranial cruciate tears, and everybody's got a cranial cruciate tear. And in the horse world, it's a little bit like having suspensories. Now, these things are designed to work correctly, and most of them become dysfunctional. And we love bringing it back to genetics. Oh, he's got an abnormal tibial femoral angle, blah, 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 blah. Why? Because for hundreds and hundreds of years, these dogs have been running around absolutely fine. Now, all of a sudden, every other dog has got a tear in its knee. Is it the knee? In my opinion, and I really don't think that that's where it comes from. I think everything is all of these things are secondary. So being able to identify dysfunction, as Dr. Morgan was saying, early on is great. So helps get your kid, get your husband, your wife to hold your dog in front of you, try to square them up, Start at the back end, run your fingers down the hamstrings, which are those big bulgy muscles at the back end, right by their bum. And you're going to bring your hands all the way down. You're going to feel for any heat, any swelling, and obviously any changes. You can even feel when you run your hands down the hamstring, are they loading more on one side? Because one side might feel like it's working a little harder, even just standing there, than on the other side. So if you run your hands down there, look at that big bum. We want dogs to have Beyonce butts, okay? Because when they have Beyonce butts, they're able to articulate their pelvis, which is where the power comes from, and be able to actually propel themselves forward as opposed to being Rocky Balboa in front and pulling themselves along. That is not a normal movement for a dog, other than potentially pitties, staffies, bulldogs, because they have these like really weird shaped forelimbs. But for most dogs, we want this nice big butt. So if we're not getting a big butt, we've got something going on there because we're not using those muscles to squat, right? So start there. Then you're going to run your hands along the sides of your dog's back. So with the little spinous processes, so those little bones that run down the spine all the way to the head, you're just going to put your hands on either side and run down there. And sometimes what you're going to feel is as you come off the bum muscle, it's going to get like a little chunky around that lower back. And when we get that chunkiness around that lower back, it means they're using their back, not their butt, to get that movement. So keep that in mind. Keep going all the way to the shoulders. Run your hands down the shoulders as if you're caressing them. And you will feel whether there's imbalance there. Sometimes you can even put your hands on top of the shoulder blades and you might see one is higher than the other, which means that we've got a big dysfunction happening either in the shoulders, the neck, the sternum, or something's going on there, or the thoracic spine, which is causing those shoulder blades, like your friend with the C shape, to be skew. And when we're constantly skew, that fascia is adhering, we're not getting the right biomechanics. So all the way down to the foot, and then get up into the neck, see if that feels right. And then I love a little stretch called the cookie stretch, and the dogs love it too. So take one of their high value treats and bring their head around towards their butt and see if they can go either side the same. And range of motion is wonderful. If you can get your dog to lie down for a couple of minutes and just feel out the shoulders, feel out the elbow, the forelimb, and the carpus, get and see if there's any kind of squishy bits, any heat, any swelling, anything like that that might be going on. You don't need to know muscle groups. You don't need to know fancy terms. We love this, as in the veterinary and the medical world. We love throwing terms out at you. Well, the right brachiocephalicus has got an adhesion at around C5. And you go, I'm sorry, did you just swear at me? Which is completely not helpful to the owners when you can go, his neck's kind of stiff here. That's all you really need to know. And as owners, once you find those things, what I always tell my clients to do is put a pressure on their eyeball. So literally the pressure you're going to put on your eyeball is a very, very safe pressure to start doing some work through that myofascial. Everybody thinks we've got to be super hard and stick an elbow in and do WWF on our animals. We really don't. Just doing some skin rolling to release that fascia, do some massage. You're really not going to do any harm. I've never seen anybody hurt anything by doing light little effleurage and petrissage movements. So you're just really just running your hands, trying to break down some of those adhesions. Some dogs will tolerate heat, some dogs won't. Just totally depends on your animal and whether it's applicable in that case. Because if in acupuncture, some dogs run hot, some run cold, it just depends. I would never put heat on. A little bit of warmth is fine. But doing some massage, doing some very subtle stretching where you're not yanking or pulling, but doing a little stretch also helps to open up that fascia, helps to release the muscle, and really the dogs really enjoy it too.
Oh, absolutely. So a couple things, there's been some questions. Somebody said, would this work in their horse? Absolutely. And
Yep.
Horses turn into silly putty when you start doing these things. They love it. Acupuncture and chiropractic on horses was one of my favorite things to do because they melt into puddles of just, I love you for doing that. They're great. Somebody asked a question when you're doing those stretches, and in horses, I call them carrot stretches, and we go to the left side, try to get around to the hip. You'll be amazed how many of them can go about that far, and they've never seen their hip. You want to do it on both sides, and you may find that one side they can get to their hip, and the other side they can barely go, and then the other one that I do with horses is a carrot held at the girth and try to get them to round up their back and get their nose down under the front legs. And you can do that with dogs too. Carrots may or may not work for your dog. You may need something better. But somebody asked a question, do they need to be standing squarely when you're doing these stretches?
Stretches, no. Evaluation, yes.
Okay.
So stretching actually is really helpful if you can get them on their side into a lateral recumbent position, because then they're not using those muscles to stabilize. So if you can get them onto their side or even into a down position for certain muscles, but on their side really is best, because then they're like just chilling, take an arm. They're not having to battle gravity and engage other muscles, which will potentially affect how good your stretch can be. So lateral recumbent, lying on their side, is always the best way to stretch.
Okay. And then when you were talking about applying heat, I can tell you for a fact that something as simple, get your hands warm first, as something as simple as just wrapping your hands on a muscle. So let's say your dog's shoulder, lay your hands on there, hold them there for a couple of minutes. The spot's going to warm up because you've got two bodies close together. And that's going to be a very subtle heat that you can just rest your hands before you start doing the massage and starting to loosen things up. Some animals like a moist heat, so like a kind of a hot, damp towel that you can lay on there. Just make sure that it doesn't feel too hot to you, so it'll be fine for them. Heating pads, be very, very, very careful, because you can get burns very easily, and you won't realize it until 2 days later when you have a blister. And then somebody's asked how we find the hot spots. And I can tell you this from when I was doing equine chiropractic. And then it was harder for me with dogs, because particularly if they're thick coated, but your hands can tell the difference in heat in an area down to about 0.5 degree. We are much more sensitive than we give ourselves credit for. So what I would do, actually what I started with was I got an infrared thermometer, and I would run that along the horse and check the temperature as I went along. And it would go up and down depending on whether we had a cold spot where they weren't getting any blood flow, or a hot spot where it was inflamed. After a couple of years, I said, I really don't need this thing. I can feel these spots anyway. But particularly in a short-coated animal, if you hover really just within about 1/2 inch and you go along, tune in, you can feel the differences. You will find hot and cold spots. Your hands are incredibly sensitive. We don't give them near enough credit.
And another little nice tip is, and I learned this years ago from a really good horseman, is you never use this part of your hand, because this is a keratin-based substance. The inside of our hand is keratin. If you use the back of your hand, you actually get a lot more thermal sensitivity than
cool.
what you do with the front side of your hand, because this is what we're always feeling with. So when you change it around, it's a little bit like if you're looking for something. We always read from left to right, and they always say if you want to look for something really well, you'll look from right to left, because your brain slows down. And this is exactly the same thing. Is like your sensitivity increases with the back of your hand. So a little bit of trivia.
Interesting. Well, see, I just learned something. That's very cool. So somebody says, is a collar harmful over time for the fascia? And this is coming from Peter Tobias's lecture yesterday, where he was talking about how harmful retractable leashes are, and how harmful collars can be from these dogs pulling and kind of screwing up. So, I mean, he was talking about it more on a spinal cord, like getting the neck out of whack. But I would think that this is affecting fascial levels tremendously.
100%, as is ill-fitting tack in horses, bad bits and bridles, in dogs, ill-fitting harnesses. I prefer harness over a collar, because dogs have a tendency to yank. They're also squirrel. and they're
Yeah.
all over. So we're yanking their entire body weight on their neck, which is a very vulnerable area. So I'm not very pro collars at all. It's fine to have one so that you have a little tag on them, but don't ever attach anything to them. And then having the correct harness where you have those shoulders that are free so that they've got really fluid movement through their body, so they don't look like they've got a tight bra on, and just like, oh, I can't do anything, because obviously biomechanics is a direct involvement with what's going on a fascial and a muscular level, as well as neurology. So making sure that your dog has got or your horse has got the correct tack and equipment in place for them, I'm totally with him. I hate a retractable lead because it's almost like letting them run a mile and then like just stopping them. It's like having a car accident every time. So that's really important not to do that, and to train your dogs so that they're not going to hurt themselves as well as you by constantly pulling against resistance.
Yeah, exactly. So so we've had a lot of people in the chat who have dogs with luxating patellas, have had patella surgery, have had TPLOs, both cruciates done. And so they're wanting to know, what causes that and what can be done in the future. And I'll put in my 2 cents, and then I want your 30 cents.
Mm-hmm.
So when I took chiropractic classes, what I was taught is that anytime we have a patellar problem or a stifle problem, it's coming from the mid-lumbar area. And so statistically, if a dog blows out one cruciate, they have about a 75 to 80% chance of blowing out the other one within a year. But if you have chiropractic care or acupuncture or something to loosen up those fascial planes, get the blood flow and electrical flow, nerve flow, get the biomechanics back going the way that they should, then you take that 75 to 80% and you drop it way down into maybe the single digits. And that is huge. So I would like your 30 cents on that as well for these dogs that have the stifle problems, basically the patellas, the TPLOs, or the cruciates, because that's what we're seeing so much of.
100%. And I think some of it is genetic. I think a lot of it is I would say, it's, in my opinion, it's more biomechanical than it is genetics. And yes, if you look at the GSDs and those sorts of dogs that have been completely changed to have these drop pelvises, yes, they are more inclined to have these things because of the tibial femoral angle. As far as luxating patellas go, most of the time it's because we have a really shallow groove, and so we're not allowing that patella tendon to actually articulate correctly, which knocks the patella out, which creates a luxation. That it can definitely be a purely structural thing, but at the same time, what often happens is because of a muscle imbalance, because of biomechanical changes, the quadricep becomes too tight. We're not activating through the gluteal muscles, so we're not actually working correctly, which makes the quad even tighter, which pulls that patella, which makes it luxate even more. So on a veterinary level, we're very pro-surgery, mainly because a lot of the time, not everybody has the correct practitioners in their sandbox that they can necessarily refer to prior to surgery, or would like to refer to prior to surgery. So there's a little bit of politics and stuff going on there too. But I've often found that if we get the quad stabilized, we engage the glute, because you always, in these luxating patella dogs, in the TPLL dogs, you always see a gluteal deficit. Always. It's almost guaranteed. We get some iliopsoas tightness, so hip flexor tightness, the quad gets tighter, the hamstring overloads. And there's no way, if we're walking around like that for a long time, that we're not going to have issues. Same thing applies to our dogs. So I think that there is 2 components to it. There is a genetic and a structural side, but at the same time, there's very, very much a functional element to it too. And if the spinal cord is working correctly, if the muscles are engaging correctly, and everything is working, most of the time we don't end up at the point where we're getting these tears and we're getting these issues. It does happen. I'm not saying it doesn't. It absolutely does. But I personally think it's because of inefficiency through the spinal cord and the pelvis, I think it's a lot of atrophy issues and imbalances through muscles that are not working concurrently or correctly. And this causes an overload in ligaments that do not have stretch, because remember that ligaments and tendons are like cotton. They have very little give. Muscles are like lycra. Wee, wee. Tendons and ligaments do this. There's nothing there. So if you are trying to move something in an incorrect manner and the muscle has done what it can and has fatigued, all that's left is the ligament or tendon that is attaching to that area, and it's going to give, and it's going to give badly. So having concurrent care, I would say chiropractic is particularly because it's structural. Acupuncture is wonderful. I'm an acupuncturist. I'm a human acupuncturist too. So I love acupuncture and needles and all of this myofascial stuff. It's very, very important to do all of that, and also at the same time make sure that you are doing the exercise component to make sure those muscles are optimally firing.
Okay, so here's a good question. Someone says, how do we get them to activate their glutes?
Well.
Let's make big butts.
Call me. No, I'm kidding. So glute activations, there's actually, it's so funny. My clients always laugh because after I adjust them, sometimes we'll do some activations to get everything firing up again. And so a little very basic thing is doing little half squats. So I call them Jane Fondas. So if you can get your dog to lie sternal, so like on all fours down, you have a little treat in front of him and you just bring it a little bit away from his nose. And what he does is he pushes up on both of his hind feet so that we get this little pelvic pump up and down. And that, if you had to try that, it's literally like a Jane Fonda move. You can tell how old I am. And we get a little bit of pelvic pumping to activate those glutes, get those nerves and muscles to fire so that we get that little glute activation. Backing up is a great exercise. It also tells you a lot biomechanically as to what the dog can do. Because once we take the shoulder out of the equation and we get the dogs to back up a little bit, they're having to use those glutes and those hind limb muscles only because we've taken the shoulder out of the equation.
Interesting.
So there's a whole bunch of
how about
exercises.
The sit to stand? I call them doggies squats, but
yeah. So sit to stand is a great exercise. The only issue with sit to stands is if it's actually a much bigger movement than what we think about. So if there is any kind of issue going on a little bit down through the limbs, and we have got a knee issue or a tarsal issue or anything like that, it can change the sit to stand. So what you'll sometimes see is the dog throws out a leg a little bit, and that may encourage a growing in the wrong position, because then we're going to be straining an extra limb. So keeping an eye on that is really important. And so you could even do a sit to stand off a stair so that they're doing a half squat.
There you go.
So if they do have a knee issue or they do have a tarsal or an ankle issue, you can have them sit on a stair and come up again, where they're only really using those glutes and that pelvis as opposed to using knee and ankle.
I'm laughing because my Doberman, he was a big dog. He was 125-pound tall Doberman. And he used to back up to the furniture and sit down like a person with his butt on the, so would have been a perfect exercise for him. Somebody said that their dog is really needle phobic, and they're trying to figure out how to get her through acupuncture. I would say ask your practitioner if they do laser acupuncture. Try to do something less invasive. I did quite a bit of laser acupuncture for needle phobic animals. And for those of you who know my TCVM, for those wood animals who are really intolerant of needles that you really can't poke them, laser acupuncture can be very, very effective. Some of them will not even tolerate acupressure. So, and somebody asked that question back a ways. Would, for instance, getting the 4 Paws, 5 Directions book, we talked about that yesterday, and doing acupressure in some of these tight areas that they find, would that be helpful as well?
100%, absolutely. And again, every single dog or animal and human, they're all different. We all have different pain tolerances. So I would always encourage you to start light as opposed to going in deep and heavy. But acupressure is beautiful. It's so natural, you know, and most dogs respond beautifully to it. Red light therapy, even just almost like the laser pointers, with 635 nanometers, is amazing, like super helpful. Laser is beautiful, and they don't know they're having it. It's so non-invasive. It's a beautiful way of hitting those acupuncture points. I'm sure your practitioner would be able to help you with that. And yeah, acupressure, soft tissue techniques. Most dogs, even the tactile intolerant ones, love it.
So here's somebody who's, and I'll give my answer and you can give yours. My dog is having hip pain. I do massage, but he doesn't like me to touch his hips. My feeling on that is the pain is actually coming from higher up, and we need to be working in front of that area, more at the lower lumbar potentially, because that's where the nerves are coming back to feed. But that's me. What do you think?
So there's definitely, very often there's a lumbosacral component, so that like L7S1 junction can be causing problems in the hips. I think if your dog is particularly painful, doing some diagnostics to rule out any hip issues, like a hip dysplasia or anything like that, could also be incredibly helpful, so that you actually know what's going on. You know, working concurrently with your veterinary professional is really important, so that we are, you know, having baselines, and blood tests are great. X-rays are great if we're looking to rule out things, so that we can really hone in and create good treatment plans, is very, very helpful. So if your dog is particularly reactive in an area and won't let you touch it, it may be indicative of something absolutely higher up or even lower down, because they may be compensating for a knee. Or you know, or they may be having something happening at that point, but we've got to kind of rule out, you know, with animals, most things are a little bit like an onion. There are lots of layers that we need to take off to get to really the core of what is going on. So a process of elimination is really helpful in this kind of case.
Exactly. Can scar tissue left after spay neuter cause myofascial pain in the hind end?
Yes.
Not a shock there.
Yes, it absolutely can. Fairly invasive.
So somebody says, can the advanced phototonic therapy help?
Yes, because phototherapy is light therapy, right? So using different kinds of lights, you know, and this is definitely not my area of expertise, but red and blue light, and particularly combining the two for violet light, very helpful in acute and chronic cases. Can't speak much to it because it's not my area, so I'd be giving you misinformation, but light therapy has been shown to be incredibly effective.
Yeah, I have a supporter, a Facebook supporter, who that is her area of expertise. She's from Spain. So I'm gonna have to get her on and get her to talk about that more in depth, because she's had great success over in Europe with that. Okay, so what else can these guys, we still got about 10 minutes we can talk. What else? Oh, okay. Do you think skin issues can be correlated to myofascial pain?
Ooh, open Pandora's box. Yes, I do. So, if you know, just like you heard yesterday, for those of you who attended the lecture, so we love to hone in on things like lick granulomas and call them allergy based, and there definitely could be an allergy perspective, but it's a pain base. So most lick granulomas occur because the dog is trying to deviate the pain response from one area to another. So the way I explain this is like a really bad Steven Seagal movie. Okay, so he's tied up in a warehouse, he's been shot in the leg, but he's got to go and save the day. So he stabs himself in the hand and off he runs, and blah, 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 and he's Wonder Man. This is actually very, very true on a pain level. So if you look at the way that the brain responds to pain, we can only focus on one particularly acute pain at a time. So when we have chronic pain going on, which occurs in an area of your brain called the anterior cingulate cortex. And what's really interesting about that is that that area, which is your pain response, and the area of your brain that decides how you're going to react to something, is the area for chronic pain. And it's also the area that computes in humans depression and emotions. So the reason why I bring this up is because when we have a chronic pain, what the brain instinctively wants to do, particularly in an animal that is fight or flight, it knows that it needs to survive. So it actually creates an acute pain somewhere else. And by doing that, it'll create a lick granuloma. So it'll actually create a festering, horrible wound, which is really painful, so that the body is not focusing on the hip dysplasia or the lower back pain or whatever it may be. It's now focusing on that paw, but the dog can actually function so much better. So it's very interesting when you look at pain responses, and that's why when your dog starts acting differently, and I get a lot of this in clinic where people will go, I don't know what's wrong with him, he's just not himself. I'm like, I'm so glad you brought him in, because now we can actually look at what's going on, because there's something that's bugging Fluffy. And if we can get to the bottom of it really quickly, we can change that pain response, because the brain is neuroplastic. We are able to change neural responses. And this is what gets me so excited about the myofascial pain stuff and chiropractic and neurology and all that sort of thing. Because what we can do is we can change that output, which is amazing, because poor old Fluffy over here is already trying to do it by maiming himself on his foot. But we can really help him by eradicating that chronic pain so that he doesn't have to do that, which is so amazing. And you know, there's so many great, I gave you a couple of examples of exercises, and of course it's not a prescription by any means, just an example, but getting involved with people who are certified in rehab and acupuncturists and animal chiropractic. It's just so amazing. You know, we're entering a time of telehealth where if you don't have those things available to you, telehealth sessions are available. So, you know, we can talk to you about your animals and you know, deal with your veterinarians and all work together to try to give you things to improve the quality of life of your animals, which is so important.
And so on that note, I'm pretty sure you do this anyway, but I did ask you to do that for a consultation that I had where the dog was definitely having some biomechanical issues that needed to be dealt with. The owner was in agreement that the dog had the issues, and pretty much the veterinarian was like, meh. And after I talked to her, I said, no, you have issues. And I had you work with her and her dog. She was in New York and you are out west. And she was thrilled. So is that something that you routinely offer?
So I work with the veterinarians on that one, or veterinary referrals. So yes, I do, and we can definitely help you. You know, it's an educational thing, and we run through Zoom consults, which is super fun, and just give you some ideas as to how you can help your animals. It's very hard because rehab is relatively new. Animal chiropractic is not everywhere, so you know, making sure that we have these things available to your animals, and don't underestimate what you yourself as an owner can do. You can do so much to improve the quality of life of your animals. And I talk about this in my books. I talk about this in my courses, is, you know, we take away so much of our owner's power by going, oh, you don't know this. Well, you can know this, and you can be very safe knowing this. There's some things that maybe you shouldn't be doing, but there's a lot that you really can do to improve the quality of life of your dog or your horse.
Exactly.
Or your cat, for that matter.
Or
Cats love this.
horse. I mean, even yourselves, you know, it's, I'm putting your website in. drmichelb.com is the website, guys. She has tons of information on there, and people are asking me if you have books and courses. And I know a lot of your book is a clinician's guide to myofascial pain. So if you don't have a medical background, it might make you,
doesn't matter.
Might make your head spin a little bit, but it's going to give you a ton of information if you really want to dive into this stuff. And somebody asked, you know, if their dog has blown a cruciate or has a luxating patella or has some biomechanical problem that your veterinarian is recommending surgery to repair, would things like acupuncture, massage, chiropractic, PT help prior to and after surgery? And usually it is prescribed, a lot of times now it's prescribed after surgery, but I would absolutely say do it beforehand. Someone else said they started all that beforehand and the dog ended up not having to go to surgery. After 5 weeks of therapy, the dog was doing great. And I found that a lot.
Yep.
That sometimes it was people that came because they didn't want to go to surgery. And they said, I'm not putting my dog through that, and I don't have the $5,000 for it. So what else can we do? And many, many times when we improve those biomechanics, we end up avoiding surgery, which is phenomenal.
Absolutely. And prehab is everything. And
Rehab. I
as
love
you
it.
and as you were talking about before, doing something like chiropractic where we're just balancing them, all of a sudden we're allowing that area to start healing because there's not an excessive amount of pressure on there. Water therapy can be very helpful. Rehabilitation is incredible because if you've got a good rehab person, they can identify where those weaknesses are and start working on those and work on the compensations. So if the body only has one thing that it has to deal with, a lot of the time it can go and heal that on its own. I'm not saying surgery isn't necessary. In a lot of cases it is, if it's completely torn or it's just not, whatever it may be. Surgery is a great component too. But remember, if we just have one thing to deal with, a lot of the time the body can heal itself. So if we can treat everything else that is going on a compensatory level and normalize the biomechanics, get the nervous system functioning again, get the structural system and the soft tissue system working correctly, then very often you may be in a very fortuitous position that you may not need surgery, or if you do, your dog's going to be in such a better condition going in that they're going to get better so much faster.
Yeah, absolutely. Absolutely. So as you all can tell, Dr. Broadhurst is not excited or passionate about what she does at all. She's such a low-key person.
Hands are flying.
And this is why when we initially chatted, it was like, oh my gosh, you're amazing. And she's amazing because she is so passionate about this, and she really wants to help animals. And by helping animals, we help people, because your animals are like your kids to you. Otherwise you wouldn't be spending your weekend with us. So this, I think is, when you say things like myofascial pain, you kind of go, what? But now that we've had a great explanation with some really wonderful comparisons, I think it makes it a lot more understandable, and to let you know that you actually can do a lot yourself. And if you are interested in more information, go to Dr. Michelle's website. And if you want to set up a consultation with her, you'll need to include your veterinarian in that loop so that they are aware, and she will work with them and with you. And I think that is, it's important for your veterinarian to know what you're doing and what's going on, so that, just if something does pop up, they can be aware and they can help with that. So, Michelle, thank you so much. That you're amazing.
Thank you. I had so much fun. So yeah, guys.
I get the feeling you have fun all the time.
I try. I'm so privileged to be in a profession where we can really make a difference. And my goal is really just to educate people to know what's out there, because the hardest thing, I think, is people don't know what's available. And we just assume and hope that our veterinarians do, and a lot of them don't even themselves know what is available as far as alternative care goes. So, the more you know, the less you can unknow. So once you know something, you can't unknow it. So that's really the idea. So yeah, it's been so wonderful talking with all of you today, and I hope this was helpful.
I think it was very helpful. And I think there's going to be a run on Play-Doh on Amazon today.
Yeah, it's just kind of fun. It's like, it really shows you a lot.
It's really fun.
Really cool. Yeah.
And then when my granddaughter gets old enough to play with it, I'll just give it to her.
There you go. Awesome.
All right. Thank you very much. Enjoy the rest of your day. We really appreciate it.
You too. You guys all take care. Be well.
Bye, everyone. Bye. See you at, oh God, what time do we start? 1:00.